No. Yes. Simple question. Is it true that the 2019, 2020, 2021, 2022, 2023 batches of allied professional workers are still home through or false? You are the Minister of Health. Can you answer that?
Doc, the years, two things. If I check, these 8,000 or so that we employed, of course, they would have come from this stream. What could have happened is that not all for every year was absorbed. That's either one. Or those who absorbed might have even preceded this government.
Is that your answer?
So
as you check, I don't know.
You don't have the information.
Then based on the preponderance of evidence I have received from the affected persons, I put it to you that the 8,000 figure you gave as allied professional workers you have employed over the period you indicated are batches that precede 2019.
You missed the courtroom.
None of the professionals, okay, who are part of the 2019, 2020, 2021, 2022, 2023 batches has been posted.
It's very possible.
No, that is a fact.
Hold
on. I'm not interjecting.
It's very possible.
I'm not interjecting. That's number one. So let's settle that. I don't like talking plenty without communicating. That is a fact. That is settled. Hold on, my brother.
No, we are in this field. What you said is a jab, but
I take it back.
It's not a correct.
I take it back. Yes. I take it back. That's fine. Number two is that Dr. Boye says we need more allied professional workers.
Oh yeah.
We need more.
Yes.
So why is he contradicting himself?
Right.
If we need more of them, then how come that for how many years, 2019 to 2023, 4 years, okay, batches of 4 years, spanning 4 years, are still home? Not a single of them has been employed. And you are giving excuses about fiscal space. Even the facilities cannot accommodate all.
Is it not a fact that for the health ministry to employ health workers, it always needs clearance from the finance ministry?
Yes.
And the clearance from the finance ministry is hinged on the finance ministry's belief of government's capability to absorb the financial implications of that. To the extent that even in 2016, your own party, there were problems. The then finance minister came under a lot of attack from your people for even bringing the clearance quite late in absorbing. So it looks like it is a problem.
No, we've always had a problem with the posting of health workers. The point, recruitment, posting, whatever. But the point is that this is not the ordinary problem we know of. You are talking about 4 years. 5 years, actually.
5 batches.
So we are not just talking about 1 batch staying home, 2 batches staying. No.
So it's going from bad to worse.
It's getting worse. And initially, I got the impression from the submission that we didn't need as many as the number of allied professional workers we were training. Later on, he clarified that he's not saying that. We need more. So if you, as the Minister of Health, and you have masters in public health, you understand? Apart from the fact that you're a medical doctor. So you understand the health needs of this country. Look, this polio matter that he held a press conference on yesterday is a function of surveillance, disease surveillance and control. You understand? COVID is all about surveillance. The people who do that are not doctors, they are not nurses. They are these allied professional health workers we are talking about.
Right.
So their role in the health sector is very important. And I'm happy you have clarified that we need more. So if we need more, how come that 4, 5 batches are staying home and your government is not doing anything about it and you are giving us flimsy excuses? That's number 2. Number 3, we are not saying absorb all of them. Doc, if the complaint I got was that 4, 5 batches, we are home. Government has absorbed only 50%. The remainder, 50%, are still home. Doc, you think that our posting would have been the same? So nobody is expecting you to absorb, but at least absorb some. Look, I want to look into your camera and tell And I just received another message that pharmacists and pharmacist assistants, since 2020, 2021, they are all home. Look, my brothers and sisters, fellow countrymen and women, this is the Ministry of Health. Okay? Clearly, you can see that he doesn't have a solution for you. But I'm here to tell you that we have 81 days to make an important decision. That decision is going to define your own future and the future of your children. So the choice you make on 7th December 2024 is very important. You cannot endorse this government which has had 8 years to transform your life, but has woefully failed to do so, and is still giving you flimsy excuses for not employing you. The opportunity you have is to vote for change. The opportunity you have is to vote for a man who is tried and tested, a man who has handled similar challenges before and passed with distinction. And I'm talking about His Excellency John Dramani Mahama. In our manifesto, we have spoken about HR gap analysis, human resource gap analysis, which we have done. And I have all the data. It is based on international best practice relative to the number of professionals, the ratio of professionals in critical state institutions to the population. That ratio. So police, health workers, and all that. And we have seen huge gaps.
That's in the public service.
In the public service. Okay. That must be filled for efficiency, so that citizens can get better services from the government. We are committing to fill those gaps. So most of you will get jobs into the public service based on the HR gap analysis we have done. Number two, the 24-hour economy will create 3 shifts in many of the health and allied health institutions that you people are supposed to work in. And the 2 additional shifts will create vacancies for you. So you will get opportunity to work and earn a living. And number 3, we have spoken about a migration policy. A migration policy. In fact, our 2024 manifesto, this is what we said about it. We will deliver a migration policy framework to export surplus Ghanaian workforce through bilateral arrangements with sister nations. If Cuba can export doctors to Ghana, Ghana can export allied health professionals to countries who need them. We can do so. We can export them to African countries, deprived countries, and all that. And so Joe Mama is clear in his mind. We will employ most of you in the public service through the HR gap analysis. The 24-hour economy will also help a lot of you to get vacancies in the public service and also in the private sector. And this migration policy framework will help even those who will not be able to find jobs in the country to find jobs outside the country. So vote for a government which is interested in solving the problems, and not those who will come and sit here and give you lectures about the problem and flimsy excuses. He says that he's waiting for financial clearance from the finance ministry. The reason why they are not giving him that financial clearance is because they have chopped the money. They've wasted the money on digging a hole for God. A hole which has turned out to be the biggest swimming pool in the world. That is why they don't have money to employ you. That money could have employed all of you sitting home. The money they have wasted on the so-called National Cathedral. I have not even come to the money they have wasted on so-called COVID-19 expenditure, which according to the Auditor General, bordered on plaintively. And their own parliamentary candidate for Sanerigu, Felicia Tete, has confessed to that. So it's a matter of priorities. Their priority is corruption and waste. Our priority is you. Mahama cares for you, so don't make a mistake. Vote for change. Vote for John Mahama. Come 7 December 2024, and this problem will be fixed, because the government, the incumbent, clearly does not care, and you can see that from the posturing of the Ministry of Health. Doc, I'm done.